I have asked 3 patients particularly to come up here and talk to you about their experiences. And it's not really designed to be like a very intensive talk. I'm not designing to pressurize them in any way. So we've asked them to share some photographs. We'll talk about those with you. And then you can really ask them lots of questions and we can have a really engaging discussion and really talk about how the patient experiences and how we can make it better. So with that being said, let's please ask Martyn Wells, Ian James and Esther Allen to join me on the stage. Great. We have Martyn, Ian and Esther, and if you don't know them already, Martyn, Esther, Ian, because they haven't sat in the order, but that doesn't matter. It doesn't matter. And it's fine. So before we kick off into it all, Martyn, a stage 4 patient, diagnosed back in 2017. He's actually treated at the QEH in Birmingham. He'll go into more detail in a minute so that because there's no point in me telling everyone your story, even though you sent it to me in writing. But he's had what I would consider to be life-changing surgeries. And surgeries that would set most people back and make most people pause, or perhaps even revert and sort of really become the traditional model of a very vulnerable patient. No, not Martyn. Martyn decided to take his diagnosis, stick 2 fingers up to it and take on probably the most unbelievable of physical challenges possible to sort of tackle his melanoma and also to raise awareness and raise money for melanoma at the same time. Ian James was diagnosed back in 2013. He is stage 1B. He's based in Wales. Now, it was really important to me to bring somebody up on stage who was an earlier stage to show you a different set of the patient demographic. And really, the reason I brought Ian up is because he's not just sort of sat there as an early stage patient going, well, that's it, it's been cut out, I'm okay now. He's gone, I'm going to address advocacy. I'm going to address raising awareness both locally and nationally and, in fact, internationally. And he's taken that to a whole other level. And I'm really, really very thankful that he's got the time to join us here. And Esther Allen, originally, I'm going to sort of do this backwards, diagnosed in 2005, but there's a small print attached to that because Esther was actually misdiagnosed age 15 back in 1996. She actually progressed to stage 4 in 2009, treated up at the Christie in Manchester. Wait for it, she's had 19 surgeries and still counting, and climbs over just about every hurdle that is thrown at her on a constant basis. It's not the surgeries that specifically and alone that I asked Esther to join us, and she'll touch on this bit as she sort of talks to you about her experiences. But one of the reasons that I asked Esther to talk is because of what I consider to be teamwork and partnership. And I haven't asked her mum Jane to come up, but I actually really do believe that as patients, our ability to navigate everything and our ability to come through it the other side, not the other side because that's wrong too, but our ability to cope and our coping mechanisms can be heightened and enhanced by our family and our friends to guide us and support us through it, for them also to become knowledge. And there's lots of carers in the room here today too. And it's really having those people around her who have, since she was 15, at various points, helped guide her through that I think is really important too. I had originally asked a 4th patient to join us. If you're on Melanoma Mates socially, you will know Mike Laverne. He's a vicar from down in Cornwall. He's one of the pioneers from the immunotherapy side of things. He's actually 12 years on in his treatment and doing unbelievably well. If you get a chance, please do talk to him online. He's not with us because he got COVID. So, in order to help them so that they don't feel intimidated, because trust me, it's really scary being up here. Really, really, really scary talking to other patients. By the way, it's not just the patients who find it scary, the professionals do too. It's not an audience that they're used to perhaps talking in front of all the time. So to make it easier for these guys, I asked them to provide me with 4 photos. So I asked them to tell me what image describes your greatest melanoma-related challenge. Start with this one. I think this might be you, Martyn. If you reach, there you go, there's a microphone.
Thank you.
Why that photo? How does that photo describe what you perceive as being the greatest challenge that you've had post-melanoma?
Well, to use an analogy, there's plenty of hills that I've got climbed along the way, and that really represents my scaling of the heights, really, of melanoma.
And how long after all of the surgeries and stuff was that actually taken?
And that was taken less than 6 months after I was in ICU.
What happened to get you to ICU, if you don't mind telling us?
I'll tell you when I tell you my story. No spoilers.
Go on, you can so share some of your story.
As a result of nivolumab, I contracted pneumonitis, which they originally thought was pneumonia, but it turns out it was pneumonitis. I had a bad reaction to Nivo. I ended up having 19 nights on a high-flow oxygen ventilator in ICU. It was touch and go for a period of time. And then I had another nearly 3 weeks in the oncology ward on oxygen. So as a result of that, all of my leg muscles atrophied. I was barely able to walk, so I had to learn to walk again. That was in March 2019. And then I walked the Cape Wrath Trail, which is known as Britain's hardest walk, in November 2019.
Amazing.
Yep.
There's a selection of photos here, Esther.
I couldn't just pick one. So I couldn't pick one, so I'll pick 4.
That's okay. Why did you pick those 4 and what do they mean to you?
So basically the first one, so I'm going to go top left. First one is me as a 15-year-old, looking, questionable. And basically the challenge of getting a diagnosis and getting referred and pushing for the referral to receive the diagnosis, basically. I think my mum took me 3 times to the doctors with a mole on my temple, and they kept saying it was nothing. And then we eventually pushed and we had it removed, and it was still nothing, but as it turned out, it was something, which we only found out 9 years later. So yeah, just that if you know something's not right, you need to just push and push. So that was one challenge. The second challenge was I had a child, and that challenge is knowing that melanoma, if it spreads whilst you're pregnant, crosses the placenta. Not everyone knows it, and not every maternity hospital, well, they might know it, but basically when my child was born, because my oncologist was also on maternity leave, sorry, there was no one actually picked up on it, so my placenta was never tested. So then when she was 4 months old and I progressed to stage 4, we didn't know if it had crossed the placenta. So then we had 3 years of her having her own oncologist. So that's a greatest challenge, is just for people to know that they need to get the placentas checked when they're having a baby. The third one is an MRI scan of a tumour near my pancreas. That challenge is to not just go with what your hospital says and what they can offer you, is to look and see what else is out there. So I had the challenge of having a tumour behind my pancreas, but my hospital couldn't offer me surgery or SABRE, and I would have had to go on to a drug treatment, and the only thing that's ever worked for me since first being diagnosed was surgery, so we really wanted to sort of locally attack it. So we had to find it ourselves, and with the help of our oncologist pointing us in the right direction. So yes, we ended up finding this SABRE ourselves and going and getting that in Oxford. And so that challenge is that finding stuff that's not necessarily at your hospital, you need to be going out and knowing what finding stuff yourself. And then the fourth one is the challenge of knowing who to go to, because there isn't a list of the best surgeons and the best oncologists in this area and the best treatments. And that's the challenge in trying, knowing where to go and not knowing where to go, and just navigating and trying to find the best people to do what you need done. So that's it. Sorry, mine's very long.
Ian, that looks like a maze.
Yeah, I mean, Esther mentioned navigation. I guess that's where part of this comes from, really. It's that, you sort of diagnosis and the maze of information and navigating your way through cancer diagnosis, melanoma. Coming to dead ends and being anxious about which way to turn. I guess there's that mental health issue around it as well. So really, yeah, that was just it for me. Diagnosis, looking for information to sort of empower myself and decide, what should be happening. Are the right things happening, And I mean, my backstory really is there was no sentinel lymph node biopsy available in Wales when I was diagnosed. Although, like, the guidance was saying, have that discussion, offer. But I didn't find out until it was too late, really. I'd had my wide excision and so on. So there was like that, what else, you're missing out on? Where do I find the information? Where, why haven't I got access to things? So really that started my journey of advocacy, I guess, in terms of like finding out more information, speaking up for myself, I guess. You sort of expect everything to go like clockwork when you're in the system in the NHS, and it doesn't always. So be prepared to challenge. I guess that's a big lesson. But yeah, so that's what I did. Found out a bit more about what the process should be, helping others, trying to help others by joining up with Melanoma Mates, the Facebook forum, and ending up as an admin on there. And then from that, go into Melanoma Patient Network Europe and going to conferences around the place. Just find out more information. It's, like I say, it has been a maze, but I guess it's sort of culminated like 18 months, 2 years ago now, with me sort of using that and joining the NICE committee as a layperson for the update of the guidelines, which are due to be published end of July this year, next month. So yes, I've been working with the professionals and updating those. So they're really one of the standards, I guess, that your care team look to in terms of what they should be offering you, but it should be also accessible to the individuals. So again, it's quite a complicated document, but hopefully through my access to people through Melanoma Mates and different areas, I can sort of point people to the right information. Because as we all know, you can Google stuff and get not so correct information, shall we say. There's a lot of scary stuff out there. So yeah, just pointing people to the right place and navigating our way out of it really is what I've been trying to do the last few years.
It's great. Thank you. So it's a horrible experience, but sometimes in amongst the mix, actually, patients can find something that they weren't expecting that has given them great joy after a melanoma diagnosis. Martin. That's a really good photo, by the way.
Thank you. This is a picture of me and my fundraising manager from Macmillan. I put that down as a great joy because it's just new friendships. Melanoma opened the door for me with Macmillan and the help that they provided me with, which was fantastic, which is why I ended up doing the 2 walks that I did to fundraise for them. But Sarah's become a very close personal friend, and it was a great joy to find a friendship in difficult times.
Yeah, and we noticed that in this room as well, actually, the camaraderie that you get from actually talking to people who either have a shared experience or can at least relate to or hear about your experiences frequently.
Yeah, your cancer journey brings you into a new circle of friends, I think.
Yeah, yeah, it really does. Esther.
So this is that having melanoma has meant that I've joined the Sheffield Cancer Choir, which has only been formed sort of just before COVID, really. And anyone who knows me knows that I just sing constantly. So it was really nice to do something that I really enjoy doing with lots of people who just get it. I've not particularly associated myself much with cancer type things throughout, just because when I was younger, I wanted to just be young and normal. But this was the first thing that I've joined that was about cancer, and there was other people with cancer there, really, and yeah, really enjoy it. Obviously, not sure how well I'm going to do it because I've just recently had surgery, so I've got like vocal cord paralysis now, so I'm not actually sure how well I'm going to be able to sing, but they're stuck with me now because they got me when I could. So, so yeah, that was that.
Thank you.
Yeah, so I guess from my perspective, I mean, that's me and my mate Adrian and our guide. So I think melanoma said to me, really, just do it. Just get out there and do things. So it was, if you've got the, the opportunity and the ability to do it. So my mate was living in Vietnam. So I just bought a ticket, shot off, and we just hired motorbikes and rode around Pa Giang province, northern Vietnam, for a couple of weeks and stuff, and I think I've done quite a few. Well, that was the first of 4 or 5 trips now I've been out there to see him and stuff. So yeah, for me it was, just if you're able physically, you've got the money, whatever, just take the opportunity and travel and see your mates and spend time with people and enjoy life.
Yeah. And something that makes you the happiest and something that sort of helps you wake up every day, helps give you the strength to sort of cope through the difficult days.
I wasn't expecting it to be me. So my family, my husband and my daughter, who was now nearly 13, going travelling, making memories with them. My husband's like amazingly positive, and I'm not, so that is very helpful. And just basically, they're the reason we get up every morning and we carry on, just to carry on making memories with them and seeing the world, and that's it, really.
I'm not sure if we're on the same lake, are we? I'm not sure. So that is exactly the same thing, isn't it? It's your family at the end of the day and getting out there. That's me and my daughter. Realizing that you don't have to shy away from the sun. Obviously, you take your precautions and stuff. I've got my hat on. Probably blew off just after that as my daughter was accelerating the boat across Lake Garda. But is it Lake Garda? We didn't collude on this. But no, yeah, that's what I did. We got ourselves a motorhome and we sort of travel around and end up in Italy and hire a boat and go on Lake Garda. So with family and just making those memories, really. That's what it's all about.
I think family and loved ones is a theme here.
Clearly, I'm not on Lake Garda. I'm in the pub next door, absolutely right. No, this is dedicated to my wife, who got me through everything that I went through. When I lost my stomach because of metastasis, it changed my world totally. It changed me as a person. I was a big 19 stone rugby player, and I'm now a 12.5 stone weakling as a result of all the weight that I've lost. I used to love, I still do love food, but unfortunately eating's a struggle on a day-to-day basis, simply because I don't have the internal volume to be able to accommodate food. So my life changed totally, and entirely overnight. And if it wasn't for the amazing woman that's my wife, I don't think I'd have been able to have got through it.
And a picture maybe that describes something that you want other patients to know about or appreciate or have as a take-home.
Yes, as I mentioned earlier on, I was part of Melanoma Patient Network Europe, and so we're all in the same boat, really, you know, across Europe, across the world, I guess, in terms of, you know, access to drugs and therapy issues and so on and so forth, and so we're sharing knowledge. You know, that's what that's all about. We meet up, share information, best practice, try and put pressure on different areas, and just, you know, it doesn't matter where you live. You know, you're all human. We've all got the same problems, and meeting great people, really. Trying to help everyone.
That's me, waist deep in white water in the Scottish Highlands, and really this picture goes to show that you know, you can push yourself to do anything that you need to do, or anything that you want to do. I didn't let melanoma define me. Instead, I went and tackled it head on in the only way that I knew best, and that was to take on a series of physical challenges. So my message really is, you know, don't let yourself be defined by cancer. Yes, it is hideous. Yes, it is awful, and we know the effect that it has on us all and our loved ones. But be yourself, live your life to the full, and enjoy yourself.
So again, I didn't just pick one picture. I picked two. The first one is an oil can and a wheel, and basically telling you to be the squeakiest wheel, and so you will get the oil. Sarah, you know how much I squeak. And just basically push. Don't wait for the letter to drop through the door. Ring up. Chase your scans. Chase your appointments. The anxiety is horrendous. You need to be pushing. And because it's your priority, is your health, so it means the most to you, so you've just got to push. And it's fine to push, and it's fine to squeak. It's fine, isn't it? So just, you know, don't just sit at home waiting for stuff to happen, just push for it to happen. And the second one is basically symbolising research that's up and coming, and know what's coming. Look ahead, look over the horizon and know what treatments are coming, so that you're prepared and you're ready for when you might need them.
And what else would you like to say about your experience as a patient? And that's the last of my slides. I'm actually going to go and sit down.
I guess I go back to the you know, it's not just the physical, is it? I think it's the mental impact, perhaps. Like, you know, that's what I would probably think of at this stage. You know, you've got the initial excisions and physical side of stuff going on, but then you've got like the anxiety that builds of what the future holds for you, your family, and so on. So I think that's been quite a tricky one, and to reach out really and get help if you need it. You know, there are places out there, people to help. So don't feel that it's just you. I think most of us have probably experienced anxiety at different stages. So, yeah, it's a big part of it. It's not just the physical.
Okay. Yeah, I'd probably mirror what Ian's just said about mental health. It really is the elephant in the room as far as patients are concerned. Obviously, the primary focus needs to be on the treatment of the disease itself, and making sure that there's some form of cure or mitigation for whatever you're experiencing. But more often than not, the actual mental impact on the patient itself and the patient's family is rarely considered. And as a result, it can be a pretty lonely place sometimes. So take care of yourself and make sure you talk to people, is my advice.
Well, I agree with these two. Mental health, yeah, that is massive. Just trying to... The physical stuff is hard, but the mental stuff you deal with literally every second of every day. So just trying to help yourself with that, really. Oh, were you going to say something?
No? Yes. Melanoma is an interesting one as a cancer anyway, because the treatments differ to what perhaps maybe are perceived as being standard cancer treatments. Maybe the treatment that you're on means that your hair doesn't fall out, or there's no visible... I mean, I know things are different with some of you where there's been surgeries that have made changes to your life, so people maybe externally might take it more seriously. But have you found that overcoming perception or other people's impression of what you've actually got as a cancer to be hard or difficult to overcome?
I'm going to pinch Martyn's phrase. I think, the old is not just skin cancer is the classic, isn't it? I think hear a lot of people say, oh, it's just skin cancer, just cut it out and jobs are good. But yeah, I don't know if you want to elaborate on that.
Yeah, I would just say that because you look normal, everyone assumes you're normal. Obviously, we are all normal. But, everyone just assumes that you're fine and healthy and whatnot. And yours isn't that serious because you just look normal. And I remember at my daughter's school, one of the mums died of cancer. And I went into the office to say, I didn't know what she died of, so I went to ask, because obviously I needed to be prepared for my child. And they said, she did die of cancer, but don't worry, it's nothing like yours. And I thought, you haven't got a clue what mine's like. But because I look all right, mine's obviously not that bad.
Yeah. But you mentioned kids and school, and that's another one as well, isn't it? It's with children, with families, telling them, talking to the families, telling them about the cancer and guiding children through the process where maybe sometimes you're actually in really good health, or there's nothing to worry about, or maybe all of a sudden you've got a progression and there is something to worry about. How do you three respectively deal with the tackling of the talking to the families and the kids in your life about melanoma?
I think I was speaking to a couple of people last night about it. My diagnosis, I sort of asked you're in that room and your head's spinning and there's all this information coming in, and one of the first things you think of is like, what do you tell your kids? Like, how do you talk to my daughter in my case? And, so I asked, and they give me some advice, and I took the advice without really considering that it needed to be tailored for my daughter and what our relationship was like, and it didn't work very well. That's all I would say, in terms of that conversation. So it's, for me, it's listen, understand your relationship and how your family respond. There isn't there isn't one, solution fits all, I don't think.
Yeah, no. I would totally agree with that. You need to do what's best for your family, and even if the advice would generally be to, tell them in a certain way or whatever, you need to do what's right for your family. For my family, my daughter knows that I've had cancer, and she knows that all my scars are to do with cancer, but she isn't actually aware of the extent of things, because obviously my cancer journey started before I had her, so she was coming to the oncology appointments when she was a baby before she started school. And because there's been big gaps in my melanoma, I've been able to live a more normal life in them times. So we didn't want her life. We wanted to protect her from worry and protect her from being scared and thinking she might lose her mom. So we've chosen that we haven't told her the extent of things. She is aware of obviously needing to be sun safe, and she's aware that I've had cancer. But until there's actually a time where I would need to have that conversation with her, then we're choosing to protect her from it.
Yeah, we've got 4 children, which are aged between 23 and 18. So fortunately, they're a little bit older, which meant that the nature of conversation that we could have with them was more mature. But we had to treat them with respect and understand their feelings and understand how they'd react, and understand that in their own quiet times of reflection, they're going to be thinking about things and internalising things in their own way. So.
And I know obviously all 3 of you are respectively at different positions and different stages and going through different challenges at the moment. But the sort of the elephant in the room, if you like, the what if things don't work out? What if you have to tackle the end of life conversation? Have you had that conversation? How do you approach the sort of the discussion, if you like, or even in your head, how do you deal with the anxiety of what happens if there are no further options?
Yeah, I try not to think about that as much as possible, to be perfectly honest with you. It's something that's obviously a nagging doubt for me, as I'm sure it is for other people as well. And it's always the what if there's a recurrence, what if something happens, what if, and I really don't know how I'd tackle that and how I'd deal with that, to be perfectly honest with you.
I'm sort of of the same opinion. I'm not there yet, so I'm not thinking of that. So yeah, I've not thought of that, so I wouldn't know how I would tackle it.
Yeah, I mean, even as a early stage patient, I guess you're always got that little nagging feeling that there could be a recurrence at some stage in the future, haven't you? So it's there in the back of your mind, and I'm sure we've all had other family members who've had different cancers and stuff, so it's not nothing new in that respect, is it? But it's I guess it's still there. You look at the stats and you think, it's like 85% chance I'll be here in 5 years, or whatever it is. You've done your 5 years, and it's like, so what happens now? And that probably means I'm fine forever, but you never know. But yeah.